In 2013, Inner South Community Health celebrates 20 years of delivering hundreds of thousands of services to residents in the cities of Port Phillip and Stonnington. The last 20 years represents a fundamental commitment to the issues of health inequity, social justice and building a real focus around the needs of our clients. "20 years ago, 3 community health organisations, Southport, St Kilda and Paran, formed an amalgamation and came together.
So the 3 entities then became the Inner South Community Health Service.
Well, I think it was the general climate at that time. We're talking about the early 90s, Jeff Kennett coming into power in Victoria. But there was a sense around that we needed to grow to be able to make sure we could continue to provide the sort of services we wanted to provide to our particular target client group.
This is the original Southport Community Health Service, which was located in South Melbourne.
Just down the hill from the South Melbourne Town Hall in Perrin Street.
I was the president of Southport at the time. So this is the first board. Frank O'Connor on the left and Anne Garrow, who's now back on the board.
There were some challenging times. The builder on this particular site went bust, but the board and the management overcame those sort of things. We got on and the place has been a great location ever since.
There was Southport, Mitford and Paran, and at that time there was no Inkerman Street.
And there were no mobile phones, and we did all handwritten case notes.
Technology was pretty limited, and I have actually got the Paran's original mobile phone. We had one phone for about 30 people, so it was always a bit of competition as to who was going to take the brick out.
There was a sense of mission. There was a sense of wanting to do what we were setting out to do for local people in these local areas. And it was about that very clear target that our clients would be those people who would otherwise not have access to mainstream health services.
We were so clear about why we were here and who it was that we are seeking to respond to.
And then of course in the late 1990s it came up that there was an opportunity to auspice what was then called the PCV, the Prostitutes Collective of Victoria. And obviously it was a way forward for another marginalised community at that time, and we spent a good 12 months in amalgamation. This place got renovated. We had this massive renovation here. It was pretty dingy and dark, and then of course we have expanded and grown and got these fantastic links now with other services, really working with women and men who want to change their profession.
Yes, and I think what impressed me, I suppose, is how staff tried to, cover the whole area of people's lives, help them in all sorts of different ways. Join a swimming group or have some physio or financial counselling or, so it was like looking at the whole person's life.
Inner South has a strong commitment to working with local communities. And we do this by engaging with them, listening to them, and allowing them to guide their own care.
The work in partnership with the Indigenous community is right up there in my view.
And welcome to Rainbow Place.
Our Rainbow Place is a continual part of history. It's a gathering place for Aboriginal and Torres Strait Islander people to come together. It started in the year 2000s, and it just had a fantastic feel to it, and it always has. Our Rainbow Place is all the colours under the sun are welcome here.
Largely, the Indigenous community is in charge of where it wants to go and how it wants to work with the Community Health Service.
And that also reflects a long-term commitment of Inner South to narrowing the gap between the First Nations peoples and the rest of the community.
We're very proud of the sense of engagement that our staff have in terms of the mission and the values and the forward thinking of this organisation.
The staff have been terrific in the way that they've really connected and provided services to their clients.
It's the wonderful work of the staff in collaboration with the individual. So the whole process is wanting people to be the best they possibly can. And if we can throw in a service that may assist that process, then that's really what it's about. It's very successful.
Our mental health programs are really some of the best practice, a holistic approach to people's mental health issues.
I think the expansion over time of the dental health program has been wonderful, and I think it's taking a health promoting approach as well, so looking at the prevention of poor oral health.
At its core, community health is interested in providing services where the client is at the centre of the care that they receive. They make the decisions, they're involved in what those decisions are and the directions that they want to take in their self-care. This is a recognition that they ultimately are in control of their own health and well-being.
I think that our continuing development of programs, the research that we do, the innovations that we've done in the past will continue.
I think if you're doing things well, I don't think we should shy away from wanting to spread that even further.
The next 20 years of Inner South, we remain very optimistic. Our growth has been rapid and responsive to the local community. We are going to continue to work with and respond to the needs of our local community. This year, part of that growth has been developing a GP clinic. Again, a sign of our desire to provide a comprehensive primary healthcare intervention for the community. We will need to remain flexible and adaptive so that the needs of the community can be met. However we change and whatever we do, we will remain true to that fundamental vision that we are committed to addressing health inequity. And we will continue to have a real focus on those people who need healthcare most. And that remains a key focus for Inner South.